Hey everybody, Chad, personal trainer with Roadrunner Sports. Today we're going to be addressing an issue that affects almost every runner or athlete at some point in their career in activity. And if you haven't suffered from it yet, there's a chance you're going to suffer from it in the future. And what I'm talking about is chronic knee pain, specifically patellofemoral pain syndrome. And so what I really want to show you guys is kind of give you a visual of what's going on in the knee, because sometimes when you've got those stabbing knee pains, it's really hard for you to locate or imagine where it might be coming from. So here we've got someone's right knee. You can see there's a lot of structures going on. There's a lot of things going on here. We've got the lateral collateral ligament. We've got the medial collateral ligament. We've got the ACL and the PCL, or the cruciate ligaments, which really help stabilize the knee. Sure, all of you have dealt with a friend or a family member that's had an injury to one of those, or maybe you have yourself. Okay, but in 15 years in the fitness industry, 99% of the time what I see is issues having to do with the patellar tendon and the patella, okay? Now, you can see that this structure keeps the patella in line and it's on a direct path. As you flex and extend the knee, that patella's got to move in a specific spot. Okay, there's a little groove. If I pull this to the side here, there's a little groove right here where that patella, you can see the back of the bone there, is supposed to fit and slide. Now, so often, due to foot imbalances or hip imbalances or weaknesses, that path gets thrown off. And now instead of that patella tracking where it's supposed to track, it slides to the side, gets misaligned, and now we've got a ton of friction, bone-on-bone contact, and that's gonna lead to a lot of inflammation and a lot of pain on every step. So let's get to the bottom of this, you guys. How are we gonna fix it? One of the easiest options is to make sure that you're wearing the right shoes. Hopefully, as Roadrunner VIP members, you guys are already familiar with the Perfect Fit shoe system, where you can have a trained technician actually video your foot strike. You can watch it yourself, and you can see how your foot strikes, and you can get the support necessary. On top of recommending the right shoes, they're going to also custom fit an insole to help give you the support you need and get your foot landing in the right spot each and every time. So you can see here's a normal insole, here's one that's been custom fit to offer a little bit more arch support. And the reason we really need that arch support is because if you look down at the foot when it strikes, if you're overpronating or breaking in, let's say you have flat feet, you don't have the arch to support the impact on each stride, that tibia or shin bone is going to internally rotate or medially deviate, and that's already going to be throwing off this path of the patellar tendon, the patella, and the quadricep tendon. You're going to get that bone-on-bone contact and inflammation. And that's where these custom fit insoles and the right shoe recommendation can make all the difference in the world. Okay, once you've addressed that issue, we've got to look at the joint above the knee coming up to the hip, specifically in relationship to the glute medius muscle. The glute medius muscle is responsible for taking the hip into abduction and really stabilizing the pelvis as you go into single leg motion, as you're stabilizing on a single leg, which obviously that's what's happening in any athletic sport and any type of running motion. Okay, so we've got to address that with some exercises that are going to help you strengthen that muscle. And I'm going to show you 3 easy at-home exercises you can do, no equipment necessary, so there's no excuses, to help resolve that and give you the strength and stability that you need to go on and get back to doing the activities that you love. All right, you guys, the first exercise I'm going to demonstrate is the most simple, but one of the most effective. And it's also going to serve as an amazing indicator for the actual strength and endurance that you have in that glute medius muscle. And we're kind of throwing it back, you guys, to the Jane Fonda days. This is a simple exercise. It doesn't seem like much. It even seems a little cheesy, but it's something that's going to be very powerful, and it's very effective. And all we're talking about is the side lying leg raise here, you guys. So again, no equipment necessary. All you need to do is pick a clean spot on the floor. You can rest your head in your arm right here. You don't want to be elevated up, so rest that head in the arm. You're gonna flex this bottom leg up to a 90-degree position, and then you're just gonna hold that top leg out. Now what's very important on this is you've got to make sure that the ankle, knee, and hip are in alignment. You can't have that leg falling forward, because that's showing us that the hip flexors are wanting to do the work for you, And really, we need to target that glute medius, which is responsible for straight hip abduction, okay? So all you're gonna do from there is slowly and in a controlled manner lift and lower this leg. Now you also want to make sure that your pelvis isn't rolling backward. That's just another position where we can get those hip flexors more involved. So keep that pelvis rolled over and just slowly lift and lower the leg. Now another important point here is that you can see I'm not using a very big range of motion. This is a small range of motion that's going to ensure that we're using only the hip. You can see if I go too high here, I start to flex the trunk and laterally flex the trunk there, and that is not the motion we want. We want to keep the motion in the hip. So it's just an easy up and down. Now you've got to make that mind-muscle connection and feel that glute medius working. If you don't feel it working, then just wait a few reps and you'll feel it kick in. But you should really be able to do about 50 of these, no problem. And if you don't and you can't, then you're looking at a weak glute medius that definitely needs to be addressed. All right, you guys, the second exercise I'm going to demonstrate may come as a bit of a shock to you because so many people would think of this exercise as a core exercise. And it is. I can tell you it's an exercise that also strengthens your obliques and your lower back. But again, it's an amazing hip abductor and a great exercise to target that glute medius, and that's the side bridge. Okay, we're going to do 2 variations. And we're going to make it real simple. The first and easier variation is just from this kneeling position. I call it the mermaid position. You're just sitting on your side. And all you're going to do is drive your hips off the ground and push them forward. So hips off the ground, the hips push forward from here, and you just stabilize. Okay? Now, from there, we can make it a little bit more challenging by trying to lift this top leg. Okay, so now we're lifting that top leg. We're really forcing this hip up off the ground into hip abduction. Now we're abducting this hip too, so you got glute medius on both sides working, and we're just sitting here and trying to hold the position. Okay, you guys, the muscles are gonna respond to time under tension, and ideal time under tension is about 45 to 60 seconds for a muscle group to really gain the maximum benefit from a strengthening exercise. So again, shoot for 45 to 60 seconds. Try to really feel those muscles contracting and burning and see what you can get done with this one. Okay, there's a second progression to that side plank, and that's just the full side plank or side bridge here. And that's just going and lengthening the lever out from the knees being a supporting point to the feet being a supporting point. So I always like to push through this top arm to make sure I'm not overloading this shoulder. We want to keep those shoulders safe too. But I'm going to split my stance, I'm going to push up, and then I'm going to get the feet stacked one on top of the other. And again, we're just trying to hold those hips up off the ground. Again, like I said, you're going to feel your oblique working, that's great. But try to get some sensation through that glute medius there. And then again, the same progression goes here, where you can lift and abduct that top leg and try to feel the glute medius on that side working as well. Again, shoot for 30 seconds on this one if it's tough for you, but ideally working up to that 45 to 60 second range. All right, you guys, before I get into this third exercise, I want to make sure that I mention, I'm demonstrating these exercises on one side of the body, okay? And you may have knee pain on only one side of the body, but it's important that you do the exercises for both sides of the body, okay? Even if you're not having issues on one side, we want to make sure we keep muscle balance. And if one side's going to be strong, the other side's going to be strong too. So again, if I'm demonstrating on one side, you've still got to do both, okay? Keep it even. Okay, the exercise I'm going to demonstrate here is a simple hip drop. And all you need from here is a sturdy wall to stand against. Okay, now if we're going to work the right hip and try to strengthen this right glute medius, we keep that leg planted on the ground. The opposing leg is going to lift up at 90 degrees. And we want to make sure this foot's nice and straight. This left leg's going to open up to 90 degrees. You're going to place the opposite hand up against the wall as well. Now all you're going to do is completely relax this hip and let it drop. So you can see as I relax, the hip translated laterally, okay? So relax and let it drop. From there, we're going to drive the foot into the ground and try to drive the head of the femur into that hip joint, into the hip socket. Okay, so it's relax, drive the foot down, and try to lift the pelvis and drive the hip into the joint. Again, relax, drive the foot through the ground, and try to drive that hip into the pelvis. Now, don't stop there. Once you get that pelvis upright and you feel that hip is moving into the socket, keep driving that foot into the ground. You want to feel like you're trying to push your foot through the ground, and I can tell you what, right now, if I put my hand here on that glute medius muscle, I feel one heck of a contraction, and I'm already starting to get a real solid burn after just a few reps. This is a little bit more technical, but definitely probably I would say the most powerful glute medius strengthener there is. So again, drop the hip, drive it up, and drive that foot to the ground. Again, make that mind-muscle connection, and I would say shoot for about 15 reps, holding for about 3 seconds at the top. That puts you right in that 45 to 60 second range for the exercise. Okay, you guys, now in dealing with this patellofemoral pain syndrome and that stabbing pain in your knee, I know it's inevitable that you're gonna go out for your run, you're gonna play your sport. Sometimes you don't have a choice or you just can't be held back. Now there's some tools to help assist you in alleviating that pain, okay? And we've got these straps, these performance straps that actually provide pressure to the patellar tendon and help keep it in line, so you're not gonna get that friction and that inflammation on the kneecap, okay? So we've got one option here, there's another option here. This one is a little bit more heavy duty. It's gonna wrap around the leg, and these blocks right here are again gonna apply that necessary tension to the patellar tendon and the quadricep tendon to make sure things are staying put. Okay, that being said, the inflammatory process is a healing process, okay? And we've got to try to get that inflammation to run its course and to get those tissues healed up. And the most essential elements to that are going to be rest, ice, compression, and elevation. Okay, so after those runs, again, use those supporting bands when you can, but after those runs, there's inevitably going to be a little bit of irritation and inflammation in the joint. And that's where these tools come in. Okay, you guys, these provide that compression and that icing at the same time. Two of the main elements for healing that knee. And this is something that's so often overlooked. Okay, so you get this strap put on real tight with these Velcro straps, and you can see in here there's a bladder actually that attaches inside of the straps that you can fill with ice. And as that melts into water, it's gonna provide that nice cooling effect. Okay, then elevate it. Okay, rest up, put the leg up so you can get some good blood flowing up out of the leg and back to your heart so you can get fresh oxygenated blood into the area, and all of those immune system components can come in and start to clean up the mess. Okay, and again, there's a couple different options for that. We've got another wrap here where you've got the ice pack. You just throw this thing in your freezer, wait for it to freeze up, usually takes a couple hours, slide it into the sleeve, and again, wrap it around your knee. You're gonna get the compression and the icing at the same time. And as always, make sure you elevate the knee when you're resting it. Hey guys, thanks for watching our video. As always, we wanna provide you with the best information possible to keep you strong, keep you moving, and doing the activities you love. Now, if you wanna dive a little deeper into this topic, or have any other questions or concerns or things you want us to cover, make sure you leave it in the comment section down below. Again, be safe, stay strong, and we'll see you next time.